Thank you, Mr. Chairman. I am very pleased the subcommittee is holding this hearing today. The issues affecting Americans with disabilities far too often remain out of the spotlight. Thanks to you and Chairman Dingell, we now have an opportunity to discuss these important issues. Medicare plays a vital role for the 8 million Americans with disabilities enrolled in the program. Medicaid provides not only traditional medical care through hospitals and doctors' offices and nursing facilities, but also equally important services to help those with disabilities remain and maintain their independence. Those latter services include personal care and home and community-based services that allow many people with disabilities the opportunity to live in less restrictive settings than would be possible without assistance. Medicaid must provide services effectively to beneficiaries with a wide range of disabilities, including those with developmental disabilities, physical disabilities, and intellectual disabilities. In order to ensure the needs of beneficiaries are met, Medicaid must be flexible enough to adopt to groups with needs as diverse as the disabilities that enable them to qualify for the program. The Centers for Medicare and Medicaid Services have unfortunately taken steps recently to limit the flexibility in my state, Oregon, but other states as well, to meet the needs of people with disabilities. As a former teacher, I want to express my concern with a CMS rule that will eliminate reimbursement for school-based administration and transportation services. These transportation services play an important role in filling gaps in services to ensure children with disabilities can receive the same caliber of education as other students. School-based transportation services provided by Medicaid are very important, but are still covered in only rather limited circumstances. But CMS has refused to continue providing even the limited range of services currently covered. No change to the underlying law has been made since 1988, when the agency began covering these services. CMS has nonetheless chosen to eliminate this important and narrowly tailored benefit for children with disabilities. I'm also concerned with significant new limitations on targeted case management, which are services designed to help Medicaid beneficiaries transition from institutions into the community. The CMS interim final rule on targeted case management would limit beneficiaries to case management service of only 14 days for those who have been in an institution for up to 6 months. In those 14 days, a case manager may have to find housing, job placement, personal care service, and any other service that may be necessary to successfully transition a beneficiary into the community. Such tight time constraints harm beneficiaries and make it more difficult for people with disabilities to move into less restrictive settings. I'm anxious to hear from our witnesses about the impact these CMS rules will have on people with disabilities, and also about how proposed legislation discussed today may improve services with those with disabilities. Thank you again, Mr. Chairman, for this important hearing and for this discussion.
Thank you. Next, recognize the gentlewoman from California, Ms. Escher.